Avis Landry, Communications 210, and this is my audience. Liver failure, tendon and muscle damage, heart problems, insomnia, anxiety, panic attacks, seizures, pain and mental disorders, depersonalization. These are just a few of the side effects of taking a fluoroquinolone antibiotic. So many people may have had an adverse reaction to a fluoroquinolone antibiotic and may not have correlated the actual side effects with the antibiotic taken. Today I will be informing you of the serious side effects of a fluoroquinolone antibiotic that is harmful to the nervous system, to the tendons, to the muscles, to the heart, and every organ of your body. I will also be talking about the toxicity, which is the degree to which the poisons and the degree to which the antibiotic can damage your cells, and how it's overprescribed by physicians and they haven't even become aware of the serious side effects of these antibiotics. I have been a living witness of the side effects of the fluoroquinolone antibiotic. It's affected my husband tremendously and also my family for the past 2 years. When you think of something toxic, we think of poison. And believe it or not, this antibiotic is very poisonous. They're toxic from the very first milligram of ingestion. This antibiotic is toxic for tendons, cartilage, and for the nervous system and other organs as well. These are very toxic because they aren't natural compounds. They're a class of synthetic antimicrobial agents, which is a substance that kills or inhibits the growth of microorganisms such as bacteria, fungi, or other protozoans, as well as destroy viruses. They are not biological products, but they are purely man-made, and they're chemical toxic compounds. These antibiotics are chemotherapeutical with a potent toxicity profiles, somewhat of relevation to chemotherapy. However, they are being prescribed for sinus infections, ear infections, and urinary tract infections. What do you think about, if I say chemo, can anybody tell me what they would think about? Cancer patients. So how would you feel if a doctor prescribed you an antibiotic that's on the same potency of chemotherapy, which would treat cancer patients if you had an ear infection or a sinus infection or a urinary tract infection? Women, we know that we get urinary tract infections often. So just think about how much toxicity, how much poison is going into our body just for treating a simple, common urinary tract infection. Chemotherapy is used to kill cancer cells directly, to cure specific cancer, control tumor growth, to shrink tumors, and to relieve symptoms and destroy microscopic cancer cells that may be present. As I stated before, the chemotherapeutic antibiotics is being prescribed for something as simple as urinary tract infections, ear infections, sinus infections, or unknown diagnosis. When something is that potent, being used to kill cancer cells, it should not be used for bacterial infections that are common to people as we know today. Many people get intoxicated during their first treatment, and also we don't realize we also get it in our foods. Poultry and cattle are also injected with these antibiotics. So when we're eating foods that are injected with these growth hormones so that we can grow our chickens faster because they need to produce more chickens to sell more, we're getting these antibiotics into us as well, not only through our prescriptions but through our food. My husband was prescribed Levoquin by a physician for no known reason at all for illness. We later found out that he did get salmonella poison through the peanut butter recall. I don't know if anybody remembers it, but they did have a peanut butter recall, and he had salmonella poisoning, and he was prescribed 500 milligrams of Levoquin antibiotic. The doctor had no idea what was wrong with him. We went to the emergency room, and he was like, oh, the tests will come back, everything is fine, your liver enzymes are high, we're just going to go ahead and prescribe you the Levoquin. Take it for, let's see how many days he had to take it for. Every day until all of it was gone, which was like about 5 days. And he only got through about 3 pills. And after the 3 pills, the side effects just came on strong, and we didn't know what it was. He was saying, oh, I feel tired. He couldn't sleep. His muscles were hurting, and it got to the point where he wasn't even able to walk. And we're wondering, what is it that's going on? We went back to the doctor. The doctor said they're not sure. You're fine. Your tests are coming back fine, except his liver enzyme tripled. They actually tripled the liver enzyme levels from when we first went into the hospital from the salmonella poison through after him taking the Levoquin antibiotic. So it's very important for us to know why we're taking these antibiotics, and also to know that these quinolone antibiotics are extremely potent, and they aren't necessary for the types of things. They're supposed to be the last resort for serious illnesses, not sinus infections or ear infections or urinary tract infections, but serious bacteria infections that may cause death is what it's supposed to be for, but they're just prescribing it for anything. And as soon as he started taking the pills, as I said, he began to experience serious side effects. Many injuries are caused by the fluoroquinolone. They're either permanent or they're irreversible. These damages have not healed after 5, 6, or 7 days. They're considered as permanent. But if they're irreversible damages, they cannot be reversed, and you can't return to your previous state. If you have tendon damage, you can't repair the tendons. Even if you have surgery, you can't get back to the state that you were. So this is what we call the irreversible damage. Almost all intoxications of the quinolones are not linked right away to the antibiotic by the patient, neither by the doctor. Only a handful of doctors are aware of the devastating problem, and the rest are uninformed by technical matters which the manufacturers conceal the real toxicity until it became black labeled. Just recently it was black labeled, and they had to put it on there and list all of the side effects. But when he was prescribed, he was not listed on there, so we just taking it because it's an antibiotic, because the doctor prescribed it, and we're trusting them that they have our best interest at heart. So many are undiagnosed, and they're often misdiagnosed for fibromyalgia, lupus, Lyme disease, multiple sclerosis, rheumatoid arthritis, mitosis, diverse heart problems, or neuropathies of every kind. Okay, I have a question. Have any of you ever had any quinolone drugs prescribed to you?
Yes.
Okay. Ciprofloxacin, that's also in the quinolone family, and you also have these side effects. So what you need to do is think about, have I ever had any of these symptoms? There is a multiple list of symptoms that you can have besides the liver failure, the tendon, the muscle, the heart failure.
Heart failure.
Heart palpitations is what you, okay. There's so many different side effects, and if you would have to, you can go to the website is www.fqresearch.com, and you definitely can get a lot of this information, and it would be helpful to you just to look it up. Levoquin, Avelox, Cipro, Floxin, Tequin, or Noraxin. These are some of the main quinolone antibiotics that are often prescribed by the doctors. And I've informed you of the toxicity, of the damages, and how doctors aren't aware of the side effects or the seriousness of this antibiotic. And just ask yourself if you've experienced any of these side effects, and if you have, just I encourage you to look up the information. And thank you all very much, and have a good day. Thank you.